Hi, welcome to my Module 5 presentation. My name is Brooke Winecki, and I'm going to be talking about anxiety disorder. So what is an anxiety disorder? An anxiety disorder is when one experiences this constant, consistent anxious feeling that is brought upon by any problems they may be having. It could be a test anxiety, taking tests may freak them out and force them to get this anxiety disorder, or making life decisions. Life decisions can be hard for anyone, but someone with an anxiety disorder takes life decisions to the next level. There's different categories under anxiety disorder. We have social anxiety, fear of talking to people, being out in public. They have a really hard time going to parties, making friends, maintaining relationships. There's generalized disorder, kind of just a common anxiety disorder where people there's like a freak out over little things. They make things very dramatic and it's hard for them to control their emotions. There's a panic disorder, which can get really bad. Panic disorders can be very detrimental to the body, and very medical conditions that I'll talk about later. And phobias, those fears that we have over things that may seem weird to other people, but actually make a lot of sense. Yates was someone I did research on, and he said that a great quote that I really thought helped describe anxiety disorder and did a very good understanding of it. Cognitive theory has explained anxiety as a tendency to overestimate the potential of danger. Patients with anxiety disorder tend to imagine the worst possible scenario. So someone with an anxiety disorder maybe having a really great time, things are going really well for them, but they're always thinking about the negatives. They may not show it sometimes, but they're always thinking about the worst possible situation. They're always being a very negative person, thinking about the negative outcomes to things. An anxiety disorder can result from different etological factors. They can be from biological factors like genetics, psychological factors, social factors, unemployment, poverty, lack of support, or just different things that can happen, different trauma events. Certain behaviors play into that as well. Anxiety is usually associated with another medical condition, but genetics, environment, and trauma are usually those typical influences that result in an anxiety disorder. Some just deal with stress differently, and some are more vulnerable to stress, which is the gateway to an anxiety disorder. Moving on, the emotional effects of anxiety, it's that constant fear and worrying, feelings of apprehension, trouble concentrating, that tense and jumpy feeling, once again, always on edge, anticipating the worst, irritability, restlessness, constant alertness, and watching for signs of danger, feeling like the mind has gone blank. It's really hard for someone with an anxiety disorder to concentrate, and they really want to learn everything. They may be a really smart person, but something might be a little bit harder for them because their head just isn't all the way there sometimes. Physical effects, we have pounding heart, sweating, stomach upset, dizziness, frequent urination, sometimes even during times where people just have an anxious feeling, we have that need to go to the bathroom a little bit more. Shortness of breath, tremors and twitches, muscle tensions, headache, fatigue, insomnia. Insomnia is something I'm going to talk about later with medical conditions. It actually has a huge play in an anxiety disorder. Moving on to the cells, tissues, and organs. Since anxiety is a pathological condition, it's no surprise that one of the most affected areas is the brain. When one experiences an anxiety attack, the amygdala triggers an emotional response to a stressful event. The brain then triggers hormones, sends out neurotransmitters, and releases this neuropeptide S, which is a small protein that decreases sleep and increases alertness. Once again, we're getting into that insomnia. The hippocampus stores any emotional experience. So every time someone has an anxiety attack, the hippocampus is keep reminding those emotional experiences. Even if it has nothing to do with an anxiety attack, their hippocampus seems to react a little bit more highly than someone who does not have an anxiety disorder. When an anxiety attack does happen, the brain becomes essentially confused, and instead of switching nerve cells off, it turns them on. And it's as if the brakes are failing in response to a stressful event. And since the brain is the control center of the body, as we know, due to all of this is going on, the miscommunication in the brain, as well as the body going into a stress reaction, the heart works extra hard to supply that blood and pump out that blood to the rest of the body that is trying to work extra hard to keep up with the body's stressful time that it's going through. Blood pressure and respiration also increase. The dryness in the mouth occurs. And finally, the skin breaks out in a sweat. We know we're more kind of nervous that our skin breaks out in a sweat as a response. The organ systems, as we know, the heart and the blood and the skin and the lungs and the brain are all affected, so their systems are also affected in this. We have the nervous system, the cardiovascular system, the circulation, which is the blood, and the respiratory system. And anxiety disorder is also compared sometimes when it's going through an anxiety attack to a fight or flight response. The body's working 10 times as hard as it normally does during an anxiety attack. Someone with an anxiety disorder, as I mentioned earlier, is on edge most of the time, so there's this constant worry and stressful thought that can become a burden on the body and cause physical medical conditions to the body. The nervous system signals the rest of the body. The heart races as feelings of worry and concern arise. Breathing becomes very heavy and rapid. The blood has to run faster to help accommodate the rest of the body working hard. Someone's nervous system who has an anxiety disorder is always working a little bit extra harder than someone without an anxiety disorder. They're very, as you can see from before, their emotional effects are there, and the emotional effects really play a toll on the body, and the nervous system is constantly working back and forth, controlling all these emotions and trying to keep up with what this person is feeling all the time. For our short-term consequences, kind of the same thing as our physical effects of an anxiety disorder. We have difficulty swallowing, dizziness, dry mouth, rapid heartbeat, rapid breathing. We get headaches. Inability to concentrate is a big one. Someone with an anxiety disorder has a little bit harder time concentrating. There's a lot going on in their head, so sometimes they get lost. They'll be talking about something and they'll just completely forget about it. And once someone goes through this anxiety attack during the day, they might go through 1, 2, however many it may be, their mindset is off for the rest of the day. They can't concentrate as much clearly, but also they're just in a different place for the rest of the day, and it can be really hard to get back to a good state of mind. It affects their daily activities, and it can be really hard to deal with. Long-term consequences, we have substantial increase for heart problems. As I mentioned before, the heart's working extra hard, trying to keep up with the body as it's going through the stressful time. So we have possible consequences of a stroke happening even earlier in life. There's a damage to the hippocampus cells. Those hippocampus cells are working really super hard. Insomnia is a big one. Insomnia and depression as well go along with an anxiety disorder. Depression and anxiety disorder are almost as if they're best friends. They go hand in hand. If someone has an anxiety disorder, during my research I found that they're most likely to go through depression at least once in their life. So they're just going to work together really well. It can be hard because, as I mentioned, anxiety disorder is not usually the only condition. There's usually more than one condition going on there. Excuse me. There's also a detrimental impact of emotional distraction. Once again, the person's always thinking about something else. There's a lot going on in their head. But anxiety disorders can be helped. They may not be solved completely. This isn't just something that's going to happen overnight either. But people react differently to treatments. Some treatments work better than others, and some take longer to work than others. When it comes to therapy, there are 2 different types to help with an anxiety disorder. There is cognitive behavior therapy, which focuses more on the thoughts and behaviors by helping to identify one's challenges, influence beliefs and patterns. The other is exposure therapy, which is more like essentially taking the bull by the horn. This form of therapy has the patient confront the fear in a safe environment and help to gain self-control. So that person is addressing the fear head on. There's also medical treatments, whether they may work or not. Usually a medical treatment is combined with another form of treatment. Medical treatments are usually only used when an anxiety disorder affects daily lives. Complementary and alternative treatments is used outside of conventional medicine. Complementary treatment is like following a diet instead of going through a procedure. They try to find other ways so the person doesn't suffer more during their anxiety disorder if they do have to have some medical surgery done. Alternative treatments are like at-home treatments. They can be yoga, aromatherapy, or even acupuncture. The last was kind of interesting. It's a treatment called transcranial magnetic stimulation. This is where a magnet is used to activate the brain a specific mood regulation and stimulates those nerve cells. They use this for anxiety disorders, depression, and insomnia, things that really affect the brain. And they reduce the side effects of an anxiety disorder. So there are things that can be done to help treat and prevent an anxiety disorder. It's all about relaxing and trying to train the brain to stay calm, getting enough sleep, exercising regularly, trying to reduce the intake of caffeine and alcohol. We want to find techniques like deep breathing, things that are really going to help someone relax during an anxiety disorder. So there is a difference between an anxiety disorder and the feeling of being anxious, and I hope you enjoyed my presentation.